Welcome. Good day to all of you, dear doctors. Today I am talking about an important topic of MRCS Part A examination. The topic name is cardiac tamponade. Actually, cardiac tamponade describes a heart that has so much fluid around it that it cannot pump enough blood. The force of this fluid makes it hard for your heart to do its job. This is a medical emergency. A healthcare provider has to remove the extra fluid with a needle or surgery. You need quick treatment for a good outcome. Now, the question is, what is cardiac tamponade? Cardiac tamponade happens when the fluid sac around the heart fills with too much blood or other fluid and puts pressure on your heart. This prevents your heart's chamber from filling properly. When your heart cannot fill with blood properly, it cannot pump as much as and your blood pressure drops. Your heart may beat faster, more than 100 beats per minute, to try to pump more blood. Cancer, infections, trauma, and certain disease can cause cardiac tamponade. Without treatment, it is life-threatening. In the picture, you'll find that in the precardial sac has excess fluids and uh, should be removed for the treatment. Now, the question is, what happens is cardiac tamponade. Uh, in case of cardiac tamponades, inside your chest is sac called the pericardium, surrounds your heart. That's the pericardium, which surrounds your heart. The pericardium has two layers and pericardial fluid that holds your heart in place. In case of cardiac tamponades or pericardial tamponades, happens when the pericardium fills with fluid, usually pericardial fluid or blood, because the fluid has nowhere to go. Your heart runs out of room and cannot expand enough to fill effectively. As in the picture, find that here's pericardial fluid or bloods are extracted here. Now the question is how cardiac tamponade relates to the pericardial effusion. Pericardial effusion is the technical term for when the pericardium is filling up with fluid. Effusions can consist of blood or discharge and other blood component products. Epicardial effusion does not always cause cardiac tamponade, especially when the fluid builds up slowly over time. This is because it has time to stretch and make more room for fluid, and the process may not cause symptoms. Cardiac tamponade is always pressure from surrounding fluid, keeps your heart from beating properly. Now we'll discuss about the symptoms of cardiac tamponades. The symptoms are when this condition happens quickly, cardiac tamponade symptoms may include sharp pain in the chest. Here's you find that sharp pain in the chest. The pain may also radiate to extend to nearby parts of your body like arm or in the back, neck or shoulder. It may also get worse when you breathe deeply or lie flat or in case of coughing. The second number symptoms is trouble in breathing or breathing rapidly, and number three Symptoms is fainting, dizziness, or lightheadedness, change in skin color, especially pale gray or blue tinted skin, heart palpitations, where you become unpleasantly aware of your heartbeat, faster pulse, and the last symptom is altered mental status. A person with cardiac tamponade will not act like themselves and may act confused or agitated. When the condition happens more slowly, you may also have these cardiac tamponade symptoms: shortness of breath, swelling in your abdomen or legs, fatigue or tiredness. Chest discomfort typically gets better when you lean forward or sit up. Now we'll discuss about the causes of cardiac tamponade. Cardiac tamponade causes including blunt trauma such as a fall or car crash, and penetrating trauma like a stab wound from a knife, aortic dissection, advanced cancer, heart attack, tuberculosis, and inflammation or infection of the pericardium, chronic human disease like lupus, rheumatoid arthritis, and scleroderma, and heart cancer, heart or kidney failure, hypothyroidism. In some cases, cardiac tamponade can also happen after a medical procedure. This include surgery on your heart or near the pericardium, catheter-based procedures that involve your heart or churning blood vessels, placement of a device like a pacemaker, radiation therapy near your heart or pericardium, radiation therapy near your heart or pericardium. Now we'll discuss about who is at risk for cardiac tamponades. The person, those who are experiencing cardiac tamponades, fluid is more likely to build up in your pericardium if you have congestive cardiac failure, heart surgery, or catheter-based procedures, infection via human immunodeficiency virus, end-stage renal disease, autoimmune disease, and cancer, tuberculosis. Now I will discuss about the complications of cardiac tamponades. Cardiac tamponade complications include cardiogenic shock, heart failure, and death. Cardiac tamponade is dangerous because it ultimately limits the amount of blood your heart can pump. Cardiac output. This deprives your body of blood and oxygen. Eventually, it can cause your heart to stop entirely, a potentially fatal condition which is called cardiac arrest. Now we'll discuss about the diagnosis and test. How cardiac tamponade is diagnosed. Several different tests and methods can help diagnose cardiac tamponade. Healthcare providers are most likely to start with a physical examination. This will include checking your pulse, checking your blood pressure, checking your breathing, listening to your heart and breathing sounds, checking for a sign called pulse product search, where your blood pressure is the hallmark of cardiac tamponade signs and that's known as backstabs, such as low blood pressures or hypertension, bulging neck veins, heartbeats that should distant or muffled when a provider listens through a stethoscope. He'll find the backstab, which is most important. Uh, this includes jugular vein distension, hypertension, and muffled heart sounds. Questions must come through these backstabs, such as must remember low blood pressure or hypertension, bulging neck veins, or heartbeats that sound distant, or which is called muffled when a provider listens through a stethoscope. However, only 10 to 40% of people cardiac tamponade have backstabs. Now, a test would be done to diagnose cardiac tamponade. Test to diagnose cardiac tamponade includes echocardiogram, chest X-ray, CT scan, electrocardiogram, and heart catheterization. And lastly, we'll discuss about the management and treatment of cardiac tamponade. Treatment for cardiac tamponade requires removing the fluid from around heart with a procedure called pericardiocentesis. Here I find that the available treatment is pericardiocentesis. A provider may also need to repair damage related to the fluid buildup. And the question is which treatment is used for cardiac tamponade? Cardiac tamponade treatment may including aging and needle, which is called pericardiocentesis, or performing surgery. Surgery may be better option if an injury caused the cardiac tamponade. You have damage that needs to be repaired. A needle cannot raise accumulated fluid. A provider needs to remove your pericardium. In especially severe cases such as when heart stops because of cardiac tamponade, a provider can do a thoracotomy by the visits in the emergency room. The provider will need to treat the cause of your cardiac tamponade as well. Depending on what caused your cardiac tamponade and which treatment you had, you may receive pain medications, antibiotics, or other medications. Now we'll discuss about the complications or side effects of the treatment of cardiac tamponade. If pericardiocentesis are done or surgery can have the following complications: bleeding, injury to heart chambers and surrounding blood vessels, collapsed lung, which is called pneumothorax, and air in your pericardium, which is called pneumopericardium, and finally heart attack also may occur. Now and also pulmonary edema or infections or irregular heartbeat, injury to nearby organs including your liver, lungs, or stomach, and eventually finally death may be also occur. Now we'll discuss about how soon after treatment will I feel better. You should feel better when when a provider removes the excess fluid from your pericardium. You may also have a drainage tube for a day or two so the fluid can keep draining. Echocardiogram can show how much fluid is left in your pericardium. This helps the provider decide what it's time to it's time to remove the drain. I think now I've got a details idea about the cardiac components. If any questions, if you have any questions or further questions, feel free to ask us. Now I've shared in brief about cardiac components. If you follow this description, I think in the exam hall you must answer about any questions of cardiac components. Yes, shortly, the brief information is noted about cardiac components. Okay, thank you all of you, dear doctors.